Good afternoon. We're here at the Pan American Health Organization Joint Council meeting, which is where all the health ministers of the Americas come together to talk about technical topics that affect the health of you, the people of the Americas. So we have with us three experts today. We're going to talk about three related issues, which are neglected infectious diseases, HIV, AIDS, and sexually transmitted infections, and essential drugs and medicines, which are one of the ways in which we are able to deal with some of these problems that the people in the Americas face. So I'd like to start with Analia Porras. Dr. Porras is our expert on essential medicines, and perhaps she could tell us a little bit about the Pan American Health Organization's program for purchasing essential medicines, which help some of the other people deal with some of the very difficult health problems that we face. Can you tell us a little bit about it, Dr.
Sure,
Porras?
thank you. Thank you very much for the question. So, in 1999, the member states adopted a resolution that created the strategic fund, or more properly named the revolving fund for strategic health supplies. This fund, which is based on the grouping of the demand of member states in terms of medicine, especially for HIV, for malaria, and for tuberculosis and other important public health programs, allows countries to come together and have economies of scale. That meaning that we all put our numbers together so to get better pricing and better access to medicines. And what PAHO does is procure on behalf of these countries and ensuring that not only they have improved pricing, but also it has assured quality and availability in a timely basis. So in the case of some of the programs that we are talking today, for example, HIV or some of the patients suffering neglected diseases, the reason they can get medicines at the country level at an affordable price and of good quality is because countries procure through us, and we assist not only in the procurement, but more importantly, this is a technical cooperation mechanism. So we ensure that we give advice on how to use those medicines, how to better distribute them, how to use them rationally, and how to also deal with the problems if they exist when using those medicines at the country.
It's very interesting. Dr. Girinelli, we have a newly approved plan that, in a sense, aims to end the problem of AIDS and sexually transmitted infections as a public health problem. What other approaches do we have other than buying antiretrovirals and other medicines to really slow the spread of AIDS in the hemisphere?
Yeah, certainly treatment continues to be one of the strongest weapons to respond to these epidemics, but the prevention side is obviously equally important. It is part of what we call a comprehensive response to the epidemic. And today we have such a better, more detailed, more documented understanding of these epidemics so that we are in a much better position to really advise member states and their national programs as to where they should increasingly concentrate their efforts at a time when resources are also becoming scarcer and more precious. So the plan is really aiming at creating the perfect, ideal combination of interventions, both in the treatment compartment, and I would like to, before going into further details, I would like really to highlight how the region of the Americas is, in a way, in a unique position. If we look at the basic dynamics that influence access to a given commodity, we can easily identify demand and offer. Now, the region has a very strong asset in terms of being in a position to offer public health commodities with negotiated prices, with mechanisms that ensure the highest available standard of quality and safety. So member states are in a position to really access this opportunity and review the treatment options that they can consider and maximize, optimize their treatment efforts. So basically, they can really save a lot of resources and reinvest those resources both in opening more treatment, more space for treatment, and investing in prevention efforts. Talking about prevention efforts, the knowledge of the epidemic is clearly indicated that these epidemics, particularly the HIV/AIDS epidemic, is concentrated primarily in what we call key populations. Groups of the population that for their behavior assume much higher risks of transmission of HIV, including and in addition to higher degrees of vulnerability to the same, for a combination of factors that unfortunately put those very population groups at a higher risk for HIV. Talking about essentially men having sex with men, transgender populations, people who use drugs, particularly injectable drugs, and more broadly in terms of vulnerability, adolescent, women, migrant populations, prisoners, all these groups to different degrees do show a profile of much higher risk and vulnerability. Now, based on this key understanding of epidemics, action should be geared and directed increasingly more towards contrasting HIV transmission and the level of risk of those populations by providing access to information, education, and services. Can the health sector deliver all this alone? No. To do this, because of the enabling factors, because of the context of the reality, we need to have a strong alliance between health system, the health sector, including health facilities and institutions, together with civil society, with groups that have already positioned themselves much closer to these population groups, so that the synergy can realize a much better access to those prevention services.
So it's key for you to focus on specific populations in HIV/AIDS. And is that also the case? We'll try to make a transition to talking about neglected infectious diseases. Is that also the case for some of these diseases? Who are the people that we are focusing on to try to solve some of the problems that affect the poorest of the poor in many of the countries of Latin America and the Caribbean? And what can we do to help end some of these eliminable neglected infectious diseases? Dr. Castellanos.
Thank you, Daniel, for asking the question. And if we were to use this as an analogy, I would say that we should also definitely be thinking on specific group of individuals living in vulnerable conditions. And I am referring to the poorest of the poor, populations most afflicted by neglected infectious diseases are physically located in geographic regions that are under specific circumstances, isolated, socially and economically isolated, people with very little access or no access to health services, education, water, sanitation, what you would consider the basic foundations of human life. And that is the buster of opportunities that these diseases have to flourish in those populations and afflict those people. Mm-hmm. So, in the case of neglected infectious diseases, they're very unique because they come from viruses, bacteria, or microparasites. And therefore, the need of having very tailored public health interventions is a need. We work with them. A great majority of them may be tackled with medications, and we work with our colleagues to make sure that the quality of those medications is the highest possible, and the medications are always accessible when they are needed, which is not easy for various circumstances. But that's when we make the link. Concentrating in our region in a time that we may be very close to reach elimination as an ideal condition of control, not to forget that as long as it is considered eliminated, the need of continued intervention to avoid reintroduction or reestablishment of those diseases in those geographic locations will be always present. So we have a case of that, any of those diseases anywhere else in the world, the possibility of being reintroduced always exists.
I know we were all talking yesterday about the elimination of measles and what a great accomplishment that was for the region. Do you think that all the Americas will also be able to show the way on a global level with elimination of some of these neglected diseases? I know we've made great progress on Chagas, but maybe you could outline for some of the people watching on Facebook what are a couple of the other important diseases that we are on the road toward controlling or eliminating, or hope to control or eliminate.
Our new plan of action, which is very much in line with the plan of action for control and elimination of neglected tropical diseases from the World Health Organization, describes 8 specific diseases tackled for elimination in the region of the Americas. And in addition, we also mentioned 5 diseases that are very much classified as diseases that we need to increase the quality of control we do on them. But these 13 diseases, as a package, represent the diseases that have been for years properly documented to be feasible of control and elimination. And we have very recent examples of that, Daniel. So everyone may know by now that the region of the Americas hold the first, second, third, and fourth countries around the world that first reach elimination of onchocercosis. Whereas if you look at other regions around the world, there are still millions of cases of onchocercosis occurring in other regions, and we're decreasing that to around 25,000 people living at risk of being infected. That's all we have now, and that's in a location of very hard to reach geographic area in the border between 2 countries in South America, and we're very strongly committed to make that happen. That's just one instance of what we were discussing. In the Americas, we're also strongly pursuing the elimination of trachoma, this infection that may even lead people to lose their sight. It's about to start the process of verification of elimination in one of the 4 affected countries. The second country is very, very much far advanced in the process of documenting. They have also reached interruption of transmission. And we still have pending 2 other countries that will need to do additional efforts to control the disease and move towards elimination. But that kind of keeps showing you how countries are efficient in terms of reaching goals of elimination despite of the challenges, political, social, and economical challenges that we may see in countries in our region. And probably the last example I might like to mention is the enormous efforts that countries have done to interrupt transmission of Chagas disease in many regions in countries throughout the Americas. 2 great examples of that is the region of Central America, where 7 countries altogether between 2007 and 2011 pretty much reached interruption of transmission of this disease transmitted by the main vector. That does not mean that disease is no longer a threat in that area, but it does mean that the negative impact that the main insect transmitting that disease was having in that region is being minimized or completely eliminated. Now we're concentrating our efforts in other insects that can also have the ability to continue the transmission of this disease, which is much less in terms of risk, but still present, and also to reach out for those patients that were already infected before all of these efforts were put in place, and see how much benefit they can still get from the available medications in the market.
Which brings us back to medications. Dr. Porras, can you tell us a little bit more about this very innovative PAHO strategic fund, this revolving fund? I know it's separate from the revolving fund we use to buy vaccines for the countries in the Americas. We use it to buy essential medicines. But how many medicines are included in this? How big is the fund? How does it operate? I think people would be interested in hearing that.
Yes, thank you, Daniel. Actually, the fund was created in a way inspired by the revolving fund of vaccine in 1999. The scope of the fund is not only essential medicines, but we also procure diagnostics and vector supplies, vector control supplies, like bed nets or even insecticides for combating mosquitoes. So the idea of the fund, in the same manner that the revolving fund for vaccine has been doing for almost 40 years, is to get all the countries together in a way that we can add the volumes of demand of those medicines or those diagnostics, and that PAHO will then go on behalf of these countries to procure these products internationally. This kind of mechanism ensures competition, and competition is usually the most reliable way to improving your pricing when it comes to medicine. In order to do that, obviously you need, goes without saying, competitors, and that brings us to the fact that most of the medicines that we procure through the funds are generics, and are generics of quality. Generics are just medicines that are the same or equivalent as the brand brand name medicine, but that they are usually procured at a much lesser price. And they do not compromise the quality of treatment. Getting a patient treated with a generic, a good quality generic, or a innovative medicine, it's, as I said, equivalent. If in the case of HIV, it has allowed us to expand dramatically the number of patients treated because the prices sometimes are 80% less than the price of a brand name product. And basically, PAHO focus on the procurement, but mostly on the technical cooperation mechanism that allows us to provide technical cooperations to country, either through the technical areas that Massimo and Luis Gerardo here, have under their watch in terms of recommending what treatments they will use, to calculate how much they will need, and also to how they use rationally. So you don't only want to bring the medicine to the country and to the health system, but make sure that medicine is used appropriately and used when it's needed, in the way and in the doses that it's recommended, and other factors that make probably big influence of the success of your treatment. So that's what we do, not only through the strategic fund for the technical cooperation, mechanisms that we have through the unit of medicines and health technologies, and we try to help countries in a comprehensive way along what we call the life cycle of the product. So before a product gets to the market, when the product gets to the market, the way you procure, the way you purchase that product, the way you look at the quality of that product, and the way you use that product through the health programs and public health programs. And also how also the patient might have issues with that product, and what we call pharmacovigilance, and have the ability to detect those on a timely basis and take measures as necessary.
And I think it's very relevant to highlight what Nalia was mentioning in terms of the quality. For us, working with countries to control and eliminate these diseases, regardless if it is an insecticide or a medication, quality is an issue. And countries are very pleased to know that the package of standards and regulations that back the support of the PAHO through the strategic fund to procure these communities is very high. So they know for sure that even though it's in public health systems, the distribution of medications or bednets, they comply with the highest standards of products in the market. And that's important for us when we work with poor populations to try to prevent and control diseases.
So it sounds like we are really at the forefront at the global level of helping countries deal with neglected infectious diseases, with HIV/AIDS, and with purchasing and distributing technically appropriate medicaments and drugs and other equipment for public health. So in a sense, I think this shows that how this can be a really good example for other regions. Have we been asked to help some of the other areas in the world set up their own strategic fund that we know of?
Well, we usually get both of us, I think, or the three of us, through the different programs that we interact with other regions or even other international organizations, consultations of how, maybe not exactly the fund, but how pooling demand or some of these approaches and the interaction between a procurement or a procurement mechanism with the technical cooperation for access and rational use with a particular technical problem can better be improved. So we are more than willing to share that knowledge. We usually provide this information. I think also what makes this region very unique that most of the funds these programs are dealt with are public funds, are come from the own government. So, and this is a critical difference with other regions that use donor or private funds to mobilize. So I think the position of the region is pretty unique because as Gerardo and Massimo will tell you, the vast percentage of the medicines and health supplies that these programs need, both NTD, HIV, comes from the from the state monies, and it goes national treasure, and goes to the you know I think it's a pretty we are very proud of the responsibility taken by national health policies to do that.
I think that's a good note on which to end our Facebook Live broadcast for today, because we have shown how some of the programs that the ministers of health are talking about at these meetings of the PAHO Directing Council are being implemented throughout the Americas, both for neglected infectious diseases, for HIV/AIDS and sexually transmitted infections, and for the purchase of medicaments and supplies to help us fight these scourges. So I want to thank Dr. Castellanos, Dr. Guidinelli, and Dr. Porras for
very
your
much.
contributions, and we hope to see you on a future Facebook Live presentation. And we want to thank our viewers as well for following us, and to keep looking to see if you have other questions, you can forward them, and we will pass them on as well in this or the next broadcast. Thank you very much.
Thank you
so
very
much.
much.